very good morning, everyone. It is our pleasure to have you all on board with us today. We are here to launch our project Niramay, as we're all aware. And a quick note for all the viewers who are watching us. Live streaming of the event is can be viewed in Facebook, and it can be viewed using our link that we have shared through our social media handles. So. Before we commence the launch of the project, I would like to extend my warm welcome to all the respected dignitaries from National Health Mission Assam, our project partners Cisco, and members from Piramal Foundation and Piramal Swasthya for joining us here today. Thank you to everyone. And I'm Dr. Tapashi Adhikari. I'm a research associate at Piramal Swasthya, and it gives me immense pleasure to host today's event. So before we begin, I would like to request Mr. Hardeep Singh Bamra, Vice President, Piramal Swasthya. Sir, if you could kindly proceed with the welcome note, and if you could also spare a few minutes to reflect in Piramal Swasthya's background and the interventions that we have been doing. So over to you, Hardeep, sir. Thank you.
Thank you so much, Tapashi. Thank you so much. I am so excited to be here today. Thanks everybody for joining in on time. First of all, I must extend my very warm welcome to the Honorable Principal Secretary, Government of Assam Health and Family Welfare Department, Mr. Anurag Goel. We also have the most dynamic leader, Dr. Lakshmanan, from Mission Director, National Health Mission, Government of Assam here with us. Thank you so much, sir, for joining in. And my very warm welcome to the entire team from National Health Mission, including Dr. Manoj Chaudhary, the Executive Director, National Health Mission, Ms. Pomi Borua, OSD and Deputy Secretary, Government of Assam at National Health Mission. Dr. Rahul Sharma, who has always been with us and supported us throughout. He's the State Program Officer, NCD, National Health Mission with Government of Assam. Dr. Mahibur Rahman has also joined us from the district of Buxa. He happens to be the Joint Director of Health Services in the district of Buxa. I would also want to extend my warm welcome to our partners and collaborators from Cisco. Very warm welcome to you, Mr. Harish Krishnan. Mr. Harish Krishnan happens to be the Managing Director and Chief Policy Officer at Cisco Systems, India and SAARC. And also to Mr. Ashish Vatal, who happens to be the Managing Director, Public Sector and Commercial Segments at Cisco India and SAARC. I also have my senior colleague with me, Mr. Rohit Talwar, who is the core team member at Piramal Foundation. So before we start off, I would just want to touch upon some of the background of the work that Piramal Swasthya and Piramal Foundation has been doing in the state of Assam. I'm very happy to state and very proud that we have been associated with the government of Assam for more than a decade now. Starting with the first work that we started off, one of the first 104 health helplines in the state of Assam way back in the year 2010. And ever since then, actually, there has been no looking back. In 2012, we launched the Sanjeevani mobile medical units, which is one of the unique mobile medical units in the country, which is a nurse-led model. And ever since then, we have been adding project after project. Today, we have more than 12 projects in partnership with the government of Assam. Some of them funded by government of Assam on a PPP mode, like the ones that I just spoke about. And so many others in support with so many partners and collaborators like Cisco India that we have today with us. One of the beauty of the partnerships that we have had with government of Assam is the fact that this has been a true blue partnership with government of Assam. And we are very proud of that. The government of Assam, the Health and Family Welfare Department, in the last few years, especially under the dynamic leadership of Mr. Anurag Goel and Dr. Lakshmanan at National Health Mission and their entire team have done a great job. And there are a lot of firsts to government of Assam's credit, in fact. Recently, they were also awarded for the work on NCD on a national platform. And I would really want to extend my congratulations to the government of Assam for that. We as Piramal Foundation and as the health vertical of Piramal Foundation, which is Piramal Swasthya, are very proud to be having the ability to have partnered with government of Assam in some of those initiatives and have contributed in a small way as far as it was possible for us. Not to mention a lot of them, but just a few examples. We were one of the first states, rather the first state in the country to launch the early childhood development helpline, or the ECD helpline in the country. And today that has become a showcase project across the nation, and so many other initiatives. For example, the work that we do on the Sanjeevani mobile medical units. We are probably the only mobile medical unit in the country which is at that scale. 80 mobile medical units of government of Assam, which is a nurse-led model, did not have a doctor, but we were able to leverage partnerships to actually convert them to a so-called doctor-led model, or a virtual doctor-led model, by adding telemedicine services on that. Uh, and likewise, so many other initiatives which have been firsts that we have been able to launch in partnership and support with Government of Assam. I guess this program that we are launching today, and that's the reason why I'm so proud, probably this will also be one of the first of a kind project in the country, where we are not just looking at continuum of care electronic health records. We are in fact also looking at what NDHM talks about in terms of interportability of data, continuum of care, and things like that. And it's also an example of a true blue partnership, where the government and private partners like Cisco and Piramal Foundation and Piramal Swasthya are coming together to showcase a true partnership as to how true partnership can contribute to the vision of the nation. For example, the vision of National Digital Health Mission for the country. With those words, I would want to welcome all of you once again to this grand event, to the launch. Thanks a lot to the Government of Assam team, the leaders. Thanks a lot to Cisco for joining us. Over to you, Tapashi. Thank you so much.
Thank you so much, Hadip sir, for extending the warm welcome to all our dignitaries, and for reflecting in the organization's background and also briefing us on the interventions that we have been carrying out. So there has been a slight change in the order of speakers today speaking. So before we move forward, like with since MD sir and our OSD Pomi Borwa ma'am has requested that their slots be moved further above, so they will be speaking next since they have a urgent priority at their front. So now, if I may request MD sir to, so we have with us the honor to have MD sir with us today, and like I would like to take this opportunity to introduce him. And so we have with us Dr. Lakshmanan as the IS Mission Director, NHM. And thank you so much for being with us and gracing us with your presence today, sir. And without further ado, I would like to request you to have the stage. Thank you.
A very good morning to the whole team Piramal, Hardeep ji, and all respected participants. It is definitely a very happy moment for all of us. From NHM side, myself, Dr. Lakshmanan, Dr. Manoj Chaudhary, Executive Director, NHM, and Sri Pomi Barua, OSD, NHM, all three of us are joining together. And as aptly introduced by Hardeep ji, in the coming situation, the coming scenario, digital health is the way forward. The time when patients used to go physically, register themselves, got various tests done, waited for 2, 3, 4 days to get the reports, and consultation took another few days. That time is definitely changing and rapidly changing. And this COVID pandemic has absolutely made a catalytic effect in this aspect. Now, this is not to reduce the importance of physical examination of the patient by the doctor, but it is to empower both patient and the doctor to know from the previous history, the earlier tests and reports, to understand the gradual changes which is happening in the patient for good or bad, and also to ensure that the data created by different programs, but for the same person, a lady who might have been pregnant twice or thrice, most of her data, basic data, is available in RCS portal. But what if the same lady becomes hypertensive at the age of 35 or diabetic at the age of 35? That data is created in NCD portal. And now the same lady at some point of time, 40 years of age, unfortunately gets TB. Her data goes to Nikshay portal. But it was the same person who had all these things. Now, why we don't know all these data is because we do not have a common platform where these things come together. Now there is another initiative from Government of India, which is covered under National Digital Health Mission. As of now, NDHM has started multiple workshops to work out the patient data created. It is still in very infant stage only. However, we hope that the ultimate unification of different platforms are likely to happen through NDHM. At the same time, program-based approach is also required to have successful completion of programs. These are much more target-oriented mission mode programs. Therefore, avoiding or giving up such program goals and targets is also not advisable. Considering both these challenges, I am sure the way Piramal has approached this, have tried to create a standardized platform which can actually pull data from different portals, make it much more understandable and readable to the end users. At present, we are considering the doctor or the treating faculty, but I am sure at some point of time, this will become an usable document to the patient as well. So considering all these, I appreciate the time and effort taken by Piramal Swasthya for this particular effort, and we are all hopeful that we will be getting the benefits in the coming days, not only for these programs, but overall health improvement. One last point which I would like to add, teleconsultation is going to be the major activity, whether it is based on telephone calls or through video based telemedicine facility. Probably with this digital platform, the way how Zomato works or Flipkart works or Amazon works or Swiggy works, there will be some requirement for improving this digital platform to deliver medicines also at home for such patients where it is workable. So this would be one request I would try to connect, try to place with Piramal, because now we are looking at the digital data collection and maybe linking with diagnostic services, some therapeutic services where it is applicable, safe and doable. We should try to work on that too. Thank you so much. And sir, you can add from here itself so that they can proceed with. Yeah, please. Mm-hmm. Yeah, you can come and speak.
A very good morning to esteemed members of Piramal Cisco, MD sir here and Executive Director sir here. First of all, congratulations to Piramal and Cisco for the launch of Project Niramay today, which is a major step in making Assam NDHM compliant actually. And this time, this is a pilot project I get to understand, and we will be doing it in the aspirational districts of Batsa, Barpeta, and Darong. And I hope later on we are able to extend it to other districts as well. So since telemedicine, teleconsultation has become very important, and we had actually done very well as far as teleconsultation goes, even during the COVID times with our own team. So this is going to be an important milestone for us. And all the HWCs, the 3 PHCs, I think we are going to cover 24 HWCs and around 3 PHCs, right? And again, we are also taking up another 3 FRUs. So I hope this will give a leverage to healthcare in these institutions. This will help our healthcare workers, and this will help us in collecting data at the grassroots level, which will be able to be used by stakeholders at various levels. So I'm really grateful to Piramal and of course to Cisco for having come forward to help us as part of this CSR activities. And all the best to all of you. And I'm sure we'll be able to extend this to other parts of Assam very soon. Thank you.
Okay, so thank you. Please go ahead.
Thank you so much, Dr. Lakshmanan, Pomi ma'am, and also Manoj sir for being with us here today. We understand that given your tight schedule, it was really difficult to be here, but still thanks a lot for being here. And thank you so much for your support and for guiding us throughout this project, as well as during the COVID pandemic, the support that you have been provided us. And we really look forward to incorporate your feedback that you have provided us today. And thank you once again. So, if I may now kindly move forward towards our next guest speaker. So we have with us our next speaker, Mr. Rohit Talwar. He is the Chief Technical Manager of Piramal Foundation, and I would like to kindly welcome Sir to join us here and share his thoughts and insights on digital health, as well as how Project Niramay will facilitate the preparedness of our state towards achieving the Ayushman Bharat Digital Health Mission. So over to you, Mr. Talwar. Thank you.
Thank you, Tabashi. To all the dignitaries in this forum, on behalf of Bharat Bharat Digital Collaborative, which is one of the big part of the Piramal Foundation, I'd like to welcome all of you and congratulate for the inauguration of the program in Assam with the support of Cisco and government of Assam. As in one of the big part in the foundation, we have prioritized making digital the health system of the entire country more and more digital, and try to provide as much as facilities possible on the ground with all the beneficiaries in compliance with the NDHM. And this program is as important for us, wherein we're gonna really pilot to see all the various platform, all the various services can incorporate and integrate into one platform. The way Dr. Lakshmanan also shared it, that how can we actually bring on board multiple services and provide a platform approach is exactly our vision is. So I really look forward, my team really look forward towards this kind of program, and together we wanted to bring changes on the lives of people at the ground and providing them the best services of the health system in support of the Cisco and government of Assam. So with this note, I'll thank you all for inviting on this platform and providing us an opportunity to really make this happen for the country. Thank you very much. Over to you, Tapsik.
Thank you so much, sir. Thank you for your kind words, and thank you for providing us the opportunity to collaborate with Cisco and the initiative that your organization has been taking, and all the wonderful work that we could do so far in collaboration with Cisco. And with that said, if I may now kindly request our next speaker. So we have with us Mr. Harish Krishnan, sir. So he is the Managing Director and Chief Policy Officer of Cisco Systems India and SAC. Now, if I may kindly request Mr. Krishnan to join us today and share his thoughts on the project and digital. Thank you.
Thank you, Tabashi. On behalf of Cisco, it gives me great pleasure to welcome all of you to the launch of Niramay. This is a project that we've been discussing for a number of months, and I'm so happy we are launching this today and in a great way to start the year 2022. As we heard, Niramay is a unique intervention that will leverage technology to establish a continuum of healthcare for primary level to district level through integrated health technology platform Amrit in the three aspirational districts of Buxa, Barpeta, and Darang. Under Niramay, 24 health and wellness centers, 3 primary healthcare centers, community healthcare centers, and 3 first referral units like district hospitals will be strengthened with the digital infrastructure to enable telemedicine interaction, rapid diagnostics, patient health records, and data collection at grassroots level. This is particularly a fulfilling project for Cisco as it falls squarely under our purpose agenda. The purpose of Cisco as a company globally is to power an inclusive future for all. And we all know the importance of healthcare in the inclusive agenda of India. We are also all aware of the statistics of the poor doctor, hospital, nurses, paramedics ratio to the population of India. While the government and the private sector are doing its best to narrow this gap, this will take years. And in the Indian context, I always say leapfrogging forward is not an option. What we need is to pole vault, and that is where technology helps. The ability of telemedicine to improve healthcare in India has been evident for more than 2 decades now in various forms and shapes. However, there are two critical factors for its success. One is to have a good broadband infrastructure, and secondly is a viable business model. I think what has been happening in the last few years is tremendous progress on both these fronts. Thanks again to the government of India and to the private sector. Our broadband infrastructure is growing in leaps and bounds and is one of the best in the world. This pandemic, when we're doing teleconferencing all the time, I have the opportunity to teleconference with a number of my colleagues across the world. And I must say that I find that India's connectivity is perhaps better than some of the advanced world. We have over 600 million Indians already connected through broadband, and the government is well on its way connecting 600,000 villages with high-speed broadband under this very ambitious BharatNet project where Cisco is very involved. We in Cisco believe that when you connect the unconnected, the magic happens. And we are seeing that magic happening across India. The second critical success factor is a viable business model. Thanks to the Jam Trinity, Jandan, Aadhaar, and the mobile, several viable business models are emerging in areas of healthcare. Several young entrepreneurs are evolving solutions, not only that are innovative, but also viable. In Cisco, we are particularly seeing this happen in a number of areas. We are ourselves promoting a number of startups in areas such as agriculture and healthcare through many of our programs, such as the Launchpad, through our CSR initiatives, and we are seeing a lot of traction in this space. But what is truly transformative idea that will enable healthcare in India is the Ayushman Bharat Digital Mission that will provide insurance to all the 1.3 billion Indians over a period of time. I happened to visit the NHA website today. I was amazed to see that already 2.61 crore hospital admissions have been made under the Ayushman Bharat Digital Mission, and 28,000 were registered just over the last 24 hours. That's the kind of speed at which this whole scheme is being implemented, and it is already showing impact. I am delighted that Niramay will also serve as the purpose of providing further proof points and preparedness for the rollout of Ayushman Bharat Digital Mission in the state of Assam. In this regard, I'm particularly thankful to the collaboration of NHA Assam. Niramay project is something that Cisco is funding under a corporate social responsibility program. We typically have 3 criteria for selecting projects under the CSR program. One, we see, does it address a critical social problem of the country? And healthcare indeed is a primary societal concern, and clearly that ticked the box. Second, does the solution scale? We believe there are 2 things that really help a project to scale. One is technology, and second is government partnership. And Niramay has technology and government partnership at score. So we are very satisfied the second criteria got also fulfilled. Finally, we look at the caliber of our partners to execute. And Piramal Swasthya's track record on the ground has been fantastic in recent years. We heard about their great involvement in Assam for the last 12 years. So we are very confident that Piramal Swasthya would execute this on the ground exceedingly well. I'd like to conclude once again by reiterating Cisco's commitment to its purpose statement of powering an inclusive future for all. We also, like I said, believe that when we connect the unconnected, magic happens. Niramay is indeed an initiative to connect the unconnected and provide an inclusive future for all. As I say, it takes a village to make things happen. I would like to once again thank our partners, Piramal Swasthya, the government of Assam for the partnership. I happened to also mention this project to Dr. Harish Sharma a few months ago, and he also gave his blessings for it. And I'm sure he is going to track this as we kind of progress. I would like to specially welcome and thank Mr. Anurag Goyal, Secretary Health, for his participation today. And we look forward to collaborating with Government of Assam on this project and many more. I like to really have an event that will celebrate the milestones of this initiative going forward. With these words, I would like to once again congratulate the government of Assam, our partners Piramal Swasthya, all my colleagues. I would like to especially recognize my colleague Rohini, who has been very instrumental in shepherding this program for over many months. So thank you very much, and back to you, Tapashi.
Thank you so much, sir, for such a rich and insightful speech and for reflecting with putting so much detail and adding so much nuances in how digital health is going to uh, transform the service delivery and the healthcare model in context of India, the examples that you gave and that you spoke about. So it was a very rich and insightful speech. So thank you for your valuable time. Now, if I may kindly move forward with our next guest. So we have our chief guest with us, Mr. Anurag Goel. He's the Principal Secretary, Health and Family Welfare, Government of Assam. And we are honored to have you with us today, sir. And thank you for joining and giving us your valuable time. So over to you, Mr. Anurag. Thank you.
Wish you all a very good morning. Mr. Hardeep Singh Bamra, Vice President, Piramal Swasthya. Mr. Harish Krishnan, Managing Director from Cisco. Mr. Rohit Talwar, CTM, Piramal Foundation. Dr. Lakshmanan, MD, NHM. Dr. Manoj Chaudhary, ED, NHM. OSD, NHM. Our State Program Officer for NCD program. The guests from Buxa district who have joined, and all others who are today witnessing the launch of Project Niramay. First of all, thank you very much for choosing Assam as one of the places where Cisco, under its CSR initiative in partnership with Piramal, have started this initiative for selecting initial 3 districts, aspirational districts of Assam for implementing this project. Definitely, as our MD NHM remarked in the beginning, the digital health is the way forward. The days of going for each and every small ailment to a health center physically are actually going to be over very soon. In fact, this pandemic of shown us the way that how we can actually do online consulting, how can we do telemedicine, how we can reach out to even COVID patients when they are in isolation. So the way forward definitely is the digital health. The telemedicine is the way forward. And in fact, apart from invasive testing and technologies, I think we should also be now looking at non-invasive testing. And I was going through a Google platform where I was seeing that that in US they have actually come up with a instrument which without invasive actually can measure your glucose level by just sensing from your skin. It's not gone commercial, but I have seen that it's still in the lab stage, or it has just come to maybe initial trials. But in non-invasive technologies are coming. So this is such technologies, if they come in the next 1 to 2 years, will add a lot of value to the digital health. Because then at the health and wellness center levels, at the cutting edge level, where we are now looking forward to detect more and more NCD cases, initial screening, then maybe linking those cases through telemedicine to the concerned medical professionals, and then putting them on medicine and regular follow-up through the same health and wellness center so that the people don't have to travel. So we need to have a lot of non-invasive testing also available at health and wellness centers in the years to come. The initiative by Cisco is definitely worth praising. My one point I would like to mention that whatever technologies we are today adopting are definitely replicable over other districts of the state. Only thing is that we should go ahead with technologies which are NDHM compliant, so that tomorrow when our CEO from NDNHM, Dr. Araj Sharma, comes up with detailed guidelines, our architecture should not be at loggerheads with the NDHM guidelines, so that we don't have to reinvent the wheel again. That is my only little concern, if you say it is a concern. But otherwise, we are moving on a way forward, which is definitely the way to the future. And with Piramal Swasthya, who has been involved with government of Assam for last almost a decade, and Mr. Hardeep Singh Bamra, his commitment I've seen in not only in Piramal but in other programs also. I think with Hardeep's own commitment, as well as the I will say the initiative from Cisco and with partnership with government of Assam, we will move forward on this path. And I will like to see that once this third wave or so-called third wave goes down, by the time we should have successfully implemented this program in these 3 districts, and then we should be able to expand it to maybe to the next level, to the phase 2, where we can maybe cover half the districts in Assam in the next phase, and then maybe the other half in the third phase. So I wish all the best to all the partners and stakeholders, and Assam government will definitely support this program, even if it requires later on budgetary effort, because finally this is going to be subsumed under NDHM. But again, I'm saying hats off to both Cisco as well as Piramal Swasthya for taking this forward. Thank you so much.
Thank you so much, sir, for your valuable remarks, and thank you so much for the constant support and the motivation that you have been providing us to thrive as an organization. So, with all that said, now if I may move forward to the most awaited part of today's event. So, if I may kindly request Mr. Anurag Goel sir to join us again in commencing the most significant part of today's event that we all have been waiting for. So, that is to officially declare the launch of Project Niramay. So, over to you, Anurag Goel sir.
I think we all join hands today, committing us to way forward for this project, and I declare this program open. Please.
Thank you. Thank you so much.
Thank you.
Thank you. It's a really huge thing to have witnessed this, and we all are really grateful for you declaring and the event being running so smoothly. And with that, now I would request. Okay, so there has been a lot of slow claps. Thank you all. Thank you. So now we have Dr. Lakshmanan and Pomi ma'am and Manoj sir with us. Thank you for joining again. Thank you. So now,
a very good morning, sir. Sorry, sir. While we started, sir, the screen was not very clear, sir. Thank you so much to Principal Secretary, sir, for joining the program and launching Project Niramay, sir. Thank you so much, sir.
Thank you.
thank you all once again to all the dignitaries. Now, I would request all the dignitaries and attendees present here today with us to kindly give me the opportunity to take you through the most awaited part of our event. That is, we are going to show a live demonstration of Project Niramay's operation at the facility level. And we'll shortly be seeing at a screen, we have we'll have Silky Char Health and Wellness Center, which we'll be seeing at the screen, which so a little bit brief about Silky Char HWC. So it belongs to Niskorbaha block, which is further connected to District Civil Hospital in Baksa. It's based in Baksa district. So the HWC here, which we'll be shortly seeing. So I would like to request the technical team to redirect the screen towards Silky Char HWC for all our viewers. So we have Silky Char Health and Wellness Center here. Like I earlier mentioned, it's based in Baksa district, and the HWC is equipped with Amrit, which is the digital health platform that connects beneficiaries, health facilities, and the health workforce in an integrated ecosystem. The HWC is also equipped with an ASHA door-to-door application, which is namely called as Utprerona, which allows ASHAs to register beneficiaries to the app remotely during home visits. So it allows synchronization of beneficiary data in Amrit, which can be then assessed at the facility level as well as at the referral units where the beneficiary may visit during the follow-ups. So I would also like to give a brief introduction on how Project Niramay would be operational, like how it would be functioning. So we have the project implemented currently across three districts in Assam, namely we have Baksa, Borpeta, and Darang, wherein we have selected 8 HWCs, that is 24 HWCs in total across the 3 districts. So where we have the project primarily we intend to maintain the continuum of care, and we intend to do this by using 2 devices. So we have the HealthCube device, which you can now see at the screen, which is a device that is a very simple and easy to use device which can perform a number of essential diagnostic tests. So we would now like to redirect the screen towards Silky Jar HWC. If I may kindly request the technical team. Yes, we have on screen, as you can see, we have our CHO and Asha and ANM Vido who are at the center, and we also have a beneficiary who's already registered with the Amrit app. So we have the details of beneficiaries already with us. So she has come now to the center speaking for her ANC checkup. So the beneficiary has already undergone HB and RBS test, and following blood pressure test was being measured as I was speaking, as we could see in the screen, and the result of the test, like as we could see, that it has now been synchronized with Amrit, and now it was visible a while ago, and now we are again we are seeing Amrit, which is now at the screen. So the beneficiary's blood pressure and the vitals has been already recorded through HealthCube, and which it's now synced with Amrit. So our beneficiary at the center, she still complains of persistent weakness. So what we'll do next is we'll connect her to the doctor who's at the Guwahati office, and we'll connect her through telemedicine. So shortly we'll be seeing Dr. Ashish Dirasaria, who's our specialist gynecologist. So we'll be seeing his screen shortly, and we'll be seeing how the consultation works, like how the beneficiary at the center would have the access to our doctor. So kindly stay tuned till we connect to Dr. Ashish. So one quick note. So we have Dr. Ashish with us, but there has been a slight technical glitch. So our attendees won't be able to hear a patient's voice, but you could hear Dr. Ashish speaking. So I'll, however, narrate the conversation that goes on between Dr. Ashish and our beneficiary. So over to you, Dr. Ashish.
Corpora hise. Ki hise. Oh, Aru. Mursur burai na ki deba. Eko nai na. Pesap paikara ebor sob thik ase na. Kash sordi eblak to eko nai. Eko problem nai na. Last mahika ketia hisile. Oh. Ab bacha keta ase agor. এনে বিশেষটো একো অসুবিধা নাই আগৰ ডায়াবেটিস প্ৰেসাৰ একো প্ৰবলেম নাই না কেতিয়াবা দৰব চৰব একো নাই ঠিক আছে আৰু প্ৰেসাৰ জুখিছিল আজি ঠিকে আছে না আপুনি ইয়াতে ৰেগুলাৰ হিচাপে আহি থাকিব আজি দৰব লিখি দিম মই আৰু কিবা অসুবিধা থাকিলে আপোনাক মই গাইড কৰি দিম ঠিক আছে না আমাৰ ইয়াতে সব ফেসিলিটি আছে আপোনাৰ হেমোগ্লোবিন আছে সুগাৰ আছে যিখিনি দৰব আপোনাৰ ব্যৱহাৰ হ'ব নৰ্মাল ৰুটিন দৰব সব আছে ফিটোসেন্স আছে এইবিলাক আপোনাৰ দৰকাৰী হ'ব সব আপোনাৰ ইয়াৰ পৰা দিয়া হ'ব ঠিক আছে আৰু কিবা অসুবিধা থাকিলে আপুনি জনাব আমি এনি টাইম আপোনাৰ লগতে আছো ঠিক আছে ধন্যবাদ
As we could see at the screen, so the telemedicine process was going on, and Dr. Ashish has asked the patient about the chief complaint history of present illness, and has also recommended a few basic like consultation that he provide based on the chief complaint as presented by the beneficiary. So so what happens next is the doctor, while he'll be able to view the test results which the Fetosense device has synced in with Amrit. So he could readily access those at his office, and then he'll be, based on the test results and the chief complaint as given by the patient, will be now generating his prescription, which will be shortly seeing so leveraging this seamlessly advanced technology along with telemedicine, we are envisaging to move one step closer to make healthcare service delivery available and easily accessible to our communities. HealthCube will be shortly seeing in our display. So we have here the device HealthCube, which I was earlier talking about. So it's, as we have seen, besides running essential tests like blood pressure, BP, sorry. Yes. So as you can see, this is the HealthCube, which earlier I was talking about. So this HealthCube can perform essential diagnostic tests, like we saw earlier. It measured the blood pressure of the pregnant woman who visited the center. Besides, it can also measure glucose, cholesterol, strip, hemoglobin, HIV, rapid diagnostic tests, etc. And it can also be used for combining smart diagnostics with AI enhanced technology, and the results of which can be generated very easily, and it will be readily available at the facility. And the most appealing feature of the app is that it can run without power and internet, which makes it an ideal device to be used at low resource settings. We also would like to introduce another device. So we have Fetosense, which is a smartphone-based portable non-stress test machine, which can be used for monitoring fetal heart rate. And it is a very sleek and very easy to use device. And the test can be performed without even having to use manuals, which again makes it ideal device to be used at low resource settings. So we'd also like to make a quick note here that the data that we'll be generating through Amrit and that will be stored shall be completely secured, and it will ensure the device and the whole integrated system is developed as such that it's maintained. The data of patients are maintained with utmost integrity. So we have kept that in mind while we were developing and while we were integrating both the technologies. So as we can now see at our screen, we have all the details which the doctor has assessed from the beneficiary details that were filled up during from the Asha door-to-door app in Amrit. And the doctor has been now prescribing the medications which would be easily could be dispensed from the facility where the beneficiary is still at. So not only this, as the beneficiary goes on to for further referral, comes further referral or goes to a follow-up center, a tertiary care center or a PHC, they could so the data will be, since it will be already stored and the beneficiary has just to have an ID through which the entire beneficiary detail could be generated. So that's how we close the continuum of care by the moment when the prescription generates, and now as we can see the whole beneficiary data is readily available. So the doctor has now completed the entire process of providing telemedicine through his app and as per the chief complaint and test result, and the prescription, as we all can now see, is now visible at the screen. And beneficiary has also been given recommendations during the telemedicine process. So the step-by-step process, as we have shown, shall be able to facilitate healthcare workers at HWCs to maintain a continuum of care seamlessly. So with this, we close the live demonstration. Thank you for your patience and for being a part of this auspicious virtual launch of our project Niramay. Before we conclude, however, I would like to extend a warm welcome to Dr. Etanath Sharma. He is the Joint Director of Health Services, Kolkata. Sir is here, and I would like to ask Sir to kindly join us and share his thoughts on today's event as well as Project Niramay. Thank you.
Good morning, you all. I am very much thankful to you for inviting me to this conference. Project Niramay is initiated by Piramal Swasthya in Borpeta district. They have done the Borpeta PHC, and in the Borpeta PHC, they have taken up 8 part of health and wellness center, namely Motupi, Wangasa, Lasipara, Gandaripara, Borpeta Road, Suliagata, Umuria, and Govardhana. In those health and wellness centers, they have provided laptop to the community health officers, tablet to the ALM, and 5 numbers of selected ASHAs. Through this, they are maintaining digital health records. They have also provided 2 machines, Fetosense machine and HealthQ. By Fetosense machines, fetal heart rate can be recorded, and through HealthQ, 20 plus numbers of tests can be performed. They are providing with all those equipments and all those in all those health and wellness centers. They are providing us with digital health records, rapid diagnostic tests, and teleconsultation. As Borpeta is an aspirational district, through this service in those health and wellness center, they will be able to diagnose the high risk pregnancy cases, which will give us a lot of help in minimizing the maternal mortality rate and infant mortality rate. Moreover, they are also providing service to the diabetic and hypertensive patients. I hope in near future, with this initiative, our district will be able to progress, and we shall be able to give a lot of service to our common people, and which will help us in raise our health indicators. With these few words, I conclude, and I am again thankful to the organizers for inviting me to this conference. Thank you very much.
Thank you so much, sir. It was indeed an honor for us to have you with us, and thank you for your valuable and rich insights on the project, as well as reflecting on Borpeta's background, as well as giving us slight details about how it's going to look like. So with that said, I would like to invite our next speaker. So we have with us Dr. Mohibur Rahman. He's the Joint Director of Health Services, Baksa. And sir, if I may kindly request you to join us. Thank you.
Principal Secretary Sir, Principal Secretary Health and Family Welfare, respected Mission Director Sir, SGNSM Sir, Assam, and Team Cisco and Team Piramal. To us, and I'm thankful invited us about the mission. The entire ecosystem related to the treatment and healthcare policy, making it become more effective with the initiative of Niramay. Health service provider and health facilities will be able to use this platform to provide their services to the remote part of the Vaska.
So there has been some technical glitch from Baksa. So shall wait for 1 minute and see if it would come back. So we have lost Dr. Mahibur Rahman because of some technical glitch. Extremely sorry for the inconvenience. However, we'd like to move forward as we move ahead towards the closing ceremony of the event. So before we go forward, I would like to request Mr. Vinod Kurmampoil, leader, Country Digital Acceleration, Cisco India and South, to kindly join us here today and give us concluding remarks for the event. Thank you, and over to you, Mr. Vinod.
Thanks, Dr. Adhikari. Good morning. A few minutes before good afternoon to all of you. Thank you for being here and to grace this occasion as we do this wonderful program, which is in line with our national digital health mission. If I were to just borrow and reiterate what was mentioned by Sri Anurag Goyal and Dr. Lakshmanan, digital health is the way to go forward. We at Cisco are extremely fortunate and happy to partner in this to make this an inclusive project in line with our purpose, number one. And our great partnership with Team Piramal has seen what can be delivered, and we're very happy to have seen Dr. Ashish do what will be a great service to the country as we move forward. I would like to take this opportunity to essentially thank all the people who are architecting this. We heard from Dr. Lakshman, we heard from Ms. Barua. We know we have the blessings of Dr. Manoj Chaudhary. We also had the team from Buxa. I think we lost Dr. Rahman because of connectivity issues. We also had the team from Barpeta. We also have the people who have been architecting the solution. Rohit, Talwar, you have my special thanks in shaping this wonderful platform up. And the whole team between Cisco and at Piramal are extremely thankful for having your blessings today as we aid and grow this project to the growing and the wonderful heights it needs to reach in the near future. Thank you all once again, and thank you for blessing this occasion with your presence. Back to you, Dr. Adhikar.
Thank you so much, sir, and thank you for providing us your valuable time and for your wonderful words that you've shared here with us today. With that said, I would like to conclude today's event, and I'd like to thank all the dignitaries who were present with us here today from NHM, Assam, our partners from Cisco, as well as from Piramal Swasthya and Foundation. It was a pleasure to host this event, and thank you once again for being with us. And we look forward to incorporating all your inputs, and we look forward to more collaborations and such events in the future. Thank you.
Thank you very much. Bye.
Thank you. Thank you all.
Thank you so much. Thank you, everybody, for joining in. Thank you.
Thank you, everyone.
Thank you. Thank you. Have a great day and a great weekend. Thank you.
Thank you, sir.
Thank you.